rolling stock and our levels of service. We will give you this briefing again and then opening it up for questions. And I will kick it off with our fire chief and emergency manager, Chief Nicholas Cicero. Chief.
Thank you, Chief of Staff Bennett. Thank you to the chair, CRA members, and public. Appreciate the opportunity to provide you a situational report on our actions relating to emergency management. Our section of emergency management provides a coordinated platform for planning, response, and mitigation for the events we are facing today. Events of consequence are before us today, and through the auspices of emergency management and supporting emergency support functions citywide for operational coordination, we continue to move forward. I would like to provide you a bit of a timeline with respect to information relating to COVID-19 as we continue the support of a citywide effort. We continue to support after the March 12th executive order signed by the mayor identifying a local state of emergency. Since that point, we have continued daily administrator and directors calls in which we discuss issues of importance for the city and a ramp up as the virus and circumstances prevail. We continue to support through partnerships the Citizen Information Center, as was stood up on March 17th. The City of Tampa Emergency Operations Center activated at level 2 on March 19th, and we continue to maintain that level of serviceability to this day. We provide situational briefs published daily. We provide state information that we collate daily as well. And as of this morning, state cases for COVID-19 settle at 15,698, with Hillsborough County cases settling at 631. The primary City of Tampa emergency management goals are these: to align our priorities with senior leadership in response to COVID-19, to ensure response resource requests are met while communicating with other city departments and stakeholders. We are continuing to proactively engage unified relationships with Hillsborough County Emergency Management through an integrated emergency management approach. We continue to communicate with Hillsborough County Health Department. And our main takeaway is personal responsibility and discipline with respect to social distancing and the stay-at-home orders. And that concludes my EM summary. Thank you.
Thank you, Chief. Chairman and board, next up is our City Attorney, Gina Grimes. Gina.
Good morning, everyone. Since our last COVID update on Tuesday the 30th, the governor has issued 5 more executive orders. The most significant legal development since our last COVID update was the governor's Safer at Home order that was issued on April 1st of last week. Fortunately, the governor's stay-at-home order or Safer at Home order was similar to the EPG's Safer at Home order that was already in effect. So that diminished the number of questions that were raised after the governor's order went into effect. So his Safer at Home order is very similar to the existing county EPG Safer at Home order. It urges and mandates people to stay at home unless they need to leave for 2 reasons: to conduct essential activities, such things as going to the doctors, the grocery store, conducting recreational activities. And the governor also added to essential activities something different than we had in our local order, and that was church gatherings were also identified as an essential activity. The other reason that you're free to leave your home is if you conduct essential services, and the list of certain jobs and job sectors in the governor's order was very similar in most respects to the list of essential services that we we had in the EPG Safer at Home order. To ensure that the public understood the effect of the governor's order, the city did update its website and COVID page to address the minor distinctions and some of the different terms that were used in the governor's order. But we did not have an influx of questions. Obviously, the public is becoming quite familiar with what's allowed and what's not allowed under a Safer at Home order. So his order did not generate as many questions as the initial EPG Safer at Home order. The governor also issued his own FAQs, frequently asked questions, that concisely addressed some issues that were raised in his order, and there is a link to that FAQ on the city's website. The other update I'd like to give you is with respect to as far as COVID is concerned. From a legal standpoint, we have shifted in the last week a lot of our resources towards two things in service to the city council. The first item is working on coordinating the city council regular and CRA meetings. And then the second thing is a proposal for rescheduling or resuming your quasi-judicial hearings. And we did that based on the discussion you had last week, indicating that you wanted to get back to work. So Morris Massey, who has done the lion's share of the work in our office, has been working nonstop the last week in trying to identify a schedule for, and this is with respect to your regular and CRA meetings. He's worked on the schedule. He's drafted rules of procedure. He's evaluated with T&I staff and the council attorney, communication media technology options, evaluated the venues. He has also extensively worked on the different options available so that the public can participate in the regular meetings and the CRA meetings. And that's really what's been the most difficult. He's also worked on the agenda and also all the changes in the notices for these meetings that we have to issue, the changes related to the different forms of advising the public of the different forms of participation. And of course, all of this was done in coordination with Marty Shelby, the council attorney, who I'm sure has kept you updated on all of this every step of the way. Late last night, I issued to you a memo about the second item, and that is rescheduling or resuming your quasi-judicial hearings. It's just a proposal. It's certainly not set in stone. The difficulty with developing a proposal was trying to decide or determine when it would be safe to resume quasi-judicial hearings, because those are hearings in which all the participants need to be physically present in order for us to conduct those kinds of hearings. So we evaluated the number of applications from all the canceled public hearings in March, April, and May, and then evaluated the new applications that have been filed, and the public has been able to file a substantial number of additional new rezoning applications. And so in that memo, I'm asking you to consider scheduling various different hearings with various different applications in a manner that is an accelerated pace, but it would allow you then to catch up with all of the canceled hearings. You would be able to catch up by the end of June. So it's not something you have to discuss or decide upon today. It's something for you to evaluate and then consider for purposes of discussion at maybe one of the subsequent meetings. But again, I went with the direction you gave me, which was you were all ready to get back to work and you wanted to get the economy going. So to do so is going to require you to put in some extra, at least one extra night and maybe one extra afternoon. And if you do, and if we're able to have physically conducted hearings in June, then we would be able to be caught up with everything by the end of June. So with that, I am done with my my weekly COVID update.
Thank you, Ms. Grimes. Now I'll turn it over to our Police Chief, Brian Dugan, for a TPD update.
Good morning, everyone. We currently are monitoring 21 of our employees. 10 of those 21 are on quarantine. We're doing pretty good. We have had over 100 people out. Those numbers randomly change at any given moment, depending upon what's going on. I think we've taken a very conservative approach in quarantining and monitoring our employees, which is why I don't want to jinx myself, but I think we've been fairly successful when you look at it, how large of a department we are and where we stand with monitoring and quarantine. Our calls for service are down about 20%, which is huge for us. I think the big thing is people are doing their best to stay home and follow the safer at home order. And we still juggle enforcing and educating the safer at home order with traditional law enforcement. You know, I always say TPD is still open for business and we are enforcing the law, but I think the citizens are doing very good in cooperating with us. That's all I have.
Thank you, Chief Dugan. John Bennett, Chief of Staff. I just wanted to make a note and commend TPD for the work that they've been doing around the emergency shelter in the north end of the community. I've been speaking consistently with the leadership of the homeless emergency shelter, and they're very complimentary of TPD support in sharing the time up there to facilitate that operation. With that, I will turn it back to Chief LaCicero of our fire department to speak about Tampa Fire Rescue.
Good morning again. At Tampa Fire Rescue, we continue to have daily summary and meeting with administrative staff to ensure that we continue our core services of the department and making sure that the citizens' needs are met. We continue to pre-screen 911 calls to further enhance detection of flu-like symptoms and the potential for COVID-19 patients. We have ceasing all public education events and restricting as best as possible interaction with people outside of emergency response. We continue to provide direction on enhanced personal protective measures for our personnel and also constantly reminding about social distancing, facility and apparatus cleanliness, and decontamination in the face of this COVID-19 emergency. We are critically monitoring calls for service, which remain steady. Like TPD, our month-to-month comparison, we're down about 40 to 45 calls in March as we were in February. We're monitoring that. We do respond to anywhere from 25, 27 calls a day to just over 30 calls a day that are COVID related or potentially COVID related based on the 911 screening process. So you can see that there is a fair amount of activity for sick flu-like illnesses that we do respond to. We constantly are monitoring the requests for PPE, and we continue to support exposure control measures for our first responders. And to this point, we have had 2 uniformed personnel test positive for COVID-19. They are doing well, and we expect a full recovery. Thank you, and that concludes my summary on fire rescue.
Thank you, Chief LaCicero. Now I'll turn it over to Ms. Ashley Bauman, our Marketing Communications Director, for her update.
Good morning, everybody. I want to give you a layout since February. Since February 27th, the City of Tampa's earned media coverage of COVID-19 or coronavirus has reached over 1.2 billion people across the country, with a total publicity value of $3.9 million. These platforms include, but are not limited to, TV, print, and radio. Marketing and Communications has been in constant communication with our regional partners to ensure not only a streamlined communication with our residents, but the most up-to-date information as we receive incoming questions on all of our platforms. The platforms include our website, our Facebook, which reaches 75,000 people, Twitter at 189,000, Instagram at 51,000, and Nextdoor at just over 68,000. We are also communicating on TikTok, which is a new resource used to reach out to our younger residents. Our website on COVID-related page views has reached over 651,000 views. Our total new followers on social media is over 19,000. That is a total of 315,902 people we communicate with on our social media platforms, with a reach of 7.8 million people. We have put out over 60 informative videos and sent over 42 related press releases. We have sent 64 bilingual messages and 11 business relief messages, more to come as more information is available. Our Tampa Ready has over 81,000 subscribers. Beyond our traditional communications efforts, we've been hosting Facebook Live updates every day, PSAs on all iHeartRadio stations featuring a myriad of celebrity DJs. We even started a region-wide dance party every night at 6 p.m., which I'm sure a lot of you know about. Digital billboards and other paid media communication are going up around the city and county in collaboration with Hillsborough County. And that concludes my report.
Thank you, Ms. Baumann. John Bennett, Chief of Staff. I just want to point out that a lot of times Ms. Baumann's work is in cooperation with the Joint Information Center of Hillsborough County's EOC. And just a reminder to the board and to the public that we are working under emergency support functions, which includes the incident command structure. And there's a sense of local and regional support. And we're working with our Tampa Bay regional partners on a daily basis. So everything that Ashley does and discusses is in conjunction with that Joint Information Center to make sure that our messages have a focus of one voice throughout the region. With that, I'm going to turn it over to our Neighborhoods and Community Affairs Administrator, Osea Wynn, for her update.
Good morning, everyone. We're still overseeing the Recovery Call Center in the EOC. The recovery time is, the calls for the times are from 8 a.m. to 8 p.m. with weekend shifts. Sunday, Easter Sunday, we will not be live with any calls. So, but we will start up again on Monday at 8 a.m. Sorry about that. The calls are, the nature of the calls have been primarily related to the mayor and the county executive orders. And we have had legal staff present in the call center to answer those calls, as well as calls regarding social services and business resources. In addition to that, we've been doing a very intense outreach through our community partnerships to faith-based organizations. As we know that this week is Holy Week, yesterday started Passover, and in 2 weeks we'll have Ramadan. And even though we are sensitive and respect other beliefs and means of worship, we cannot relax on the message of social distancing. And so that we can continue to flatten the curve with the number of cases within the city of Tampa and Hillsborough County. So with that, we've engaged with the community, with the religious organizations. We created an interfaith PSA message of love and unity, and that should be coming live within today or tomorrow. We've also been collaborating with other community partnerships in terms of getting the word out, particularly in our Black and Hispanic communities. In our Parks and Recreation area, we have our staff providing security in our parks that are closed, as well as monitoring the trails and the boat ramps that remain open. We started a staff supporter senior program where we have Parks and Recreation employees who call our senior citizens who are registered in our program at least once a week to ensure that they're well, ensure that they have all of the needs and services that they actually need to maintain their daily lives. One thing of note is that we are constructing a number of face masks to assist where needed by using the CDC guidelines. Even though we're getting masks internally for staff, this effort will help augment if there are extra masks that are needed. That will provide a summary of our input and report for this morning.
Thank you, Osea. With that, now I'll turn it over to our Administrator of Development and Economic Opportunity, Ms. Carol Post.
Hello, good morning, everyone. Want to just give a brief report on the portfolio for development and economic opportunity. At this juncture, we are fully functioning across all our departments in telework mode. That includes housing and community development, historic preservation, and our real estate group. On the development and construction services side, as was previously reported, the administration has been fully functioning remotely for a number of weeks, including accepting applications, reviewing plans, issuing permits, and the like. Standard inspections are being done digitally or via affidavit, or when necessary, we handle situations on an as-needed basis to ensure that we avoid or comply with the 6-foot separation requirements and other safety standards. I want to speak for just one moment about our large construction site safety initiative that launched this week. As it was discussed in the past, and you may have read about, we wanted to take an additional layer of protection to apply to our largest construction sites defined as threshold sites. We have 52 of them operating across the city. And as such, over the past couple of weeks, we implemented an occupational safety spot check inspection plan. There's a number of components to it, but at its most basic, we have 22 medical professionals who've been temporarily engaged. They are nurse practitioners and other medical faculty from around the city. They're operating under the direction of a temporary medical director, and they've been trained over the past few days. They are deploying starting today. They are visiting these 50 sites on average of about 2 to 3 times a week to ensure compliance with a set of CDC standards for separation requirements, sanitizing requirements, hand washing requirements, and some pre-screening advisories that have been issued. So we are, again, trying to increase and add an additional layer of protection across our infrastructure and construction sites as an essential service. So with that, I will conclude my report. Thanks.
Thank you, Carol. We will now turn it over to Ms. Jean Duncan, an administrator over our infrastructure and mobility group. Jean?
Yes. Good morning, CRA Chair and CRA members and our public. The infrastructure and mobility group consists of the water, wastewater, solid waste, mobility, CAD, which is construction services, and facility management teams. And we have introduced social distancing and other safe protocols to all of our teams to ensure that as they continue to provide these core services, they are working in a very safe environment. So we have our teams out there, again, continuing to provide the core services that we need to have for our city to keep functioning. We're doing that in a very safe manner. Some specific things that we're working on is supporting the Raymond James COVID testing. We will be testing again tomorrow morning. That process is working very well in conjunction with our Tampa Police Department and Hillsborough County. We'll continue to do that as long as the test kits become available and make that available to our public. Another initiative that we have going on is to be placing social distancing messages out on our roadways with our variable message boards to remind folks about the practices we need to keep in place. We're also placing stencils on sidewalks as we have pedestrians and bicyclists out wanting to get fresh air and get out of their homes. we want to make sure that they continue to practice those protocols to stay safe. So we're putting those throughout the entire city in all neighborhoods, some reminders to keep the protocols in place so we can get past the curve. And that's all I have this morning to report. Thank you.
Thank you, Jean. Now we have our Chief Financial Officer discuss fiscal responsibility, Mr. Dennis Rojero.
Good morning, Chair. Good morning, everyone. I'll begin by again reminding everyone of the city's history of conservative financial management, and it being the cornerstone of our financial planning and decision-making. As you know, we've always emphasized our fund balance and reserve across all our funds, whether, for example, the general fund or our enterprise funds. So using that as our jumping off point, our broad-based emphasis, of course, will remain our critical services, parks and recreation, public safety, and public works. To that end, we're looking to adapt the current fiscal year and altering our planning for the next fiscal year. Of course, we're halfway through this fiscal year, scrutinizing our current and planned expenditures for potential deferral and alteration, either deferral to the next fiscal year or to a time when we've recovered. Pardon me. Regarding our financial risk factors, of course, they will remain both our revenues and expenditures. Our primary financial risk factor at this time, of course, is our revenues. Not only because we know they're going to go down, and they will, but also because the data lags significantly for so many of them. So to that end, we're talking with the state, we're talking with our professional finance associations and other localities. The bottom line is we're all part of the same big club, and there's the same level of uncertainty out there with many of our major revenues. Regarding expenses, as I've said, we're looking at altering our expenses to meet these headwinds, but also, of course, looking closely at what's occurring at the federal level for their current and what looks to be their future local government financial support. They have identified a significant amount in the third phase stimulus, and it appears that a fourth phase is imminent. So as we get through the detail and figure out what and when, pardon me, the funding local governments, especially the city of Tampa, will be getting, that could sand the edges off some of the revenue risk. On a positive related note, as you all know, the city has a very successful state and federal reimbursement history. It was tested and honed during and after Hurricane Irma. You had the Irma event, and then you had the months and months of scrutiny and documentation and communication required to get reimbursement. And from that, we have a tried and true process internally, and we combine that with continuous communication with both the state and federal authorities. And to their credit, our contacts at the federal and state level have been very accurate, very responsive. As such, we have a lot of confidence that the majority of expenditures associated with this emergency will be reimbursed by the state and U.S. government. So we'll track that, we'll keep everybody abreast, but our primary financial risk right now is the uncertainty associated with our major revenues. Thank you.
Thank you, Dennis. John Bennett, Chief of Staff, for a quick wrap up, and then I'll turn it back to the chairman. So hopefully that concludes the briefing from staff, and it shares the idea that in this unprecedented type of an emergency, that our focus is continuing on saving lives and defending the short-term and long-term economic situation, both inside government and within our public realm. Just a quick focus, as it was mentioned earlier, there's an emergency policy group meeting today at 1:30, and the mayor continues to focus on equitable testing opportunities within the community by working with our county and hospital and medical partners. And those opportunities continue to exist on our Tampa Gov site with phone numbers that reach our call center, phone numbers that reach the county's testing registration call center, as well as the Department of Health line, in addition to other contacts on the web that relate to price gouging all can be found on our Tampa Gov website. And as I mentioned earlier, there's been 55 updates on that website relating to the COVID-19 emergency that we continue to exist in. So with that, Chairman and Board, I will turn it back for any questions for the staff before I release them back to their duties.
Chief, thank you very, very much for your reports, and the other people within the administration. Thank you very much. I will now call on each CRA board member in reverse alphabetical order for their comments or question regarding the COVID-19 update. Let's please be mindful that we'll put a 5-minute limit on your comments or questions. Let's start with Mr. Vieira.
Thank you, Mr. Chair. I appreciate that. Just continue to salute the administration on their work. It's calm, measured, resolute. That's how I like it. That's how we all like it. I would tell the administration, just keep on doing the good that y'all are doing. I was glad to hear that calls for service from police are down 20%. I think that many of us were worried that the opposite would happen with this kind of an emergency. Obviously, one of the things that I think we've all heard, and I know obviously our friends in law enforcement have heard this because they've been very, very vocal about this, is that during times when people are in their homes all day, there's potentially a rise in crimes involving things like domestic violence. And I know that our Chief Dugan and our friends in law enforcement know that because they've been on the forefront of that. And that means that groups and organizations with boots on the grounds with our families, churches, charities, houses of worship, outreach organizations for battered individuals have got to be given more support from all of us in the community, every person listening. And that especially goes to religious organizations that often play a pivotal role in this endeavor. And we all know that our churches and houses of worship, yesterday I was begun Passover, I believe, and happy Passover to all my Jewish friends, they're doing a lot more with a lot less right now because the absence of live services and whatnot means that they're going to be getting less revenue. I did have a question, excuse me, if I may, to Chief LaCicero. You had mentioned, sir, and through Chief Bennett, of course, that there were a couple of firefighters who got COVID-19. I would assume, is there a presumption or assumption with Tampa Fire that any first responder who gets COVID-19 that it's work-related? How are we dealing with those folks whenever it comes to workers' compensation? Just a question of curiosity.
Thank you, sir. And as I would like to start to answer that question, I will look to hand off to Chief Bennett because just today he elaborated on some things on the HR side. But I will tell you this, we are very, very deliberate on those exposures that our personnel, and we work very, very closely with TPD, and we want the best for their employees as well. It's a very deliberate process on how we track exposures. And quite honestly, this is precise actions that we are taking because we can't afford to get it wrong, but with imprecise data on the uptake. So we're very measured in our response on how we parse those out. And on the front end, to answer your question, some of those could have been travel related. And we look very, very closely in many cases about fire rescue. And in many cases, it's pretty evident that it is an on-the-job exposure just based on the circumstances that prevail when we go through the review immediately after information comes to our side. So we look at it very, very closely. Again, it's required precise action on our part with not a whole lot of data on the front end because there's disparate parts that come in. But we do look at it very, very closely, and it can be both. But with that, if Chief Bennett's on the line, he may want to expound on the workers' compensation piece. Chief Bennett?
Thank you, Chief.
Thank you, Chief LaCicero. Great question, Board Member Vieira. So as it relates to human resources and our personnel, the mayor authorized, which actually started at the state level with state employees of public safety and others in the public safety domain, that there is a presumption for public safety workers that any test positive COVID cases would be related to their work assignments. Therefore, the presumption of workers' comp exists for both police and fire. In addition to that, many jurisdictions in the mayor has also adopted that any city employee who is test positive for COVID would also have their co-pays and deductibles waived throughout the treatment of that. And that will extend 30 days past the last day of our state of local emergency to the employee and the dependents. Because as we know, this type of virus or disease of life can be brought home to the families for those employees that are doing the essential work. So both our sworn and our non-sworn are completely covered as it relates to COVID-19. And thank you for asking that question about our personnel.
And yes, sir, Chief, I appreciate that, sir. I know that Jimmy Petronas with the state of Florida has, from what I've read, is looking at doing a presumption, I believe it is, with Florida for, state workers, I believe in medical field and in first responders. You know, down the line, I would love to see our legislature look at our workers' compensation laws, especially as they apply to medical workers on the front line and first responders, with a presumption of sorts or something nearing that for individuals who get COVID-19, because this is obviously going to be a very acute issue, I think, down the line for our workers, and I think that's important. And Mr. Chair, I want to make sure, may I ask one question, sir?
Yes,
Chair,
Mr. Pierre, please, go ahead.
Okay.
Yes, go ahead.
Thank you, just making sure. And just real quick to Chief LoCicero, if I may, I forgot to ask, with regards to timing being appropriate, as we evaluate plans to return to meetings when this crisis has passed, or when the state of emergency is lifted, how long after the state of emergency is lifted would you recommend our going back to business, so to speak, time-wise, et cetera? Just, you know, within your capacity as a chief, as a first responder, as a medical, as a safety professional, if you can answer that question, sir.
I don't know at this current time, sir, if there's an appropriate time. I can tell you that the mayor, the chief of staff, and city administration is acutely aware of needing the city and all services to totally get back on their feet. As you pick up on the news, the modeling's change. We are leaning into the issue, and we're trying to pay very, very precise attention as to the right time. But to answer your question, I don't have an answer for you at this point in time of when that date might be.
Okay. Thank you, Chief. I appreciate that. And Mr. Chair, nothing else. I'll be asking questions, if I may, on the second issue later on, if I may. But that should be it for now. Thank you, sir.
Thank you, Mr. Vieira. Now, Mr. Miranda.
Mr. Chair, I will adhere to the 5-minute rule, I promise. I just want to thank the Mayor, Castor, for doing an outstanding job, being bold and doing what she did at the outset of this horrible COVID-19. And it takes guts to do that. It takes a leader to be a leader when you have to lead. But you can't be a great leader unless you have a great chief of staff. And that I can tell you we have. But then I'm going to go down the list. You can't be a great chief of staff unless you have great department heads. And you can't be a department head, great one, unless you have great people working for you. And at the end of this, it is the people of the city of Tampa. We can pass all the laws we want. You can change anything you want. But if the people that you govern do not follow, you will be a complete failure. And I want to thank the public for adhering to all the rules and regulations that were not normal, because the quality of life has changed during this period of time, for doing the right thing, for trying to work out their families' problems with this COVID-19, for staying home, for being residual to the fact that, yes, possibly some of them were laid off. It's going to be a struggle, but we will get through this. Like I said earlier, we can always solve this problem, but we cannot solve somebody passing away because of the virus. So the people of the city of Tampa are the ones that are to be said, thank you for who you are. Thank you for what you've done, and always continue being yourself. And what I'm saying is that this is an era of life that we will soon want to forget, but we'll always remember what this country has had to go through, what this world has had to go through to continue to have some dreams and aspiration of being better. But when you do these things, like Dennis Rohero said, we better start looking at what's going to happen and how we're going to get back on our feet. And that's going to take all of us, every single one of us, not only in this city, in this county, not only in this state, but in this country, to make sure that we make steps that we can all, not just the ones on top, not the ones in the middle, but all of us, from top to bottom and from bottom to up. When the bottom falls, the top will always tumble down. So we got to be cognizant of the fact that the little people are the ones, and I mean little in financial abilities today, that were laid off, that are having problems getting their unemployment because of a system that never worked for the last 20 years, that are doing these things to get a foothold because they're the ones that are going to control the economy. If they don't spend, nothing is bought, nothing turns. This state is basically on sales tax. And when you have only one revenue, main revenue, it takes a little while to get back on your feet. And I'm sure the state, I'm sure the governor is going to do the right thing and get this state moving again. And with that, I say thank you all, especially to those in the front lines, to the healthcare workers in this city, in this country, this county, everywhere, who have taken risk way above their designated duty as an MD, as a registered nurse, as a nurse practitioner, as an anesthesiologist. Anyone in the hospital that has to do anything are putting their lives on the front line for us to have a better quality of life. And I want to say thank you to all of them, fire, police, every one of them. And my 5 minutes are up. Thank you, Mr. Chair.
Well said, Mr. Miranda. Thank you very much. Mr. Maniscalco.
Thank you very much. Always a very thorough presentation from each individual that spoke. You work tirelessly and endlessly, because it does seem like this is an endless thing, but you know, we hope to get to the end of this month with more positive numbers for flattening that curve, and doing the best we can as a people and as a community, following the requests and the instructions, you know, from the governor all the way down. I think that the social distancing is working. I do come to City Hall. I'm here at City Hall, isolated from everybody else. Everybody's in other places, and I see that the traffic is light. I don't see people out. I see people following the rules. The grocery stores might be busy, and that's normal. You know, folks have to eat and whatnot, but people are staying home and they're adhering to the guidelines. You know, again, I want to thank our mayor for her leadership and being at the forefront of this before the state stepped in. And it's true. I mean, we saw how she's been fighting to keep this community safe, this city safe, this county safe in that manner. And I really can't say anything more other than thank you to everybody for all their hard work, because this is something that we could not have imagined. And here it is, you know, from January 1st, the start of the new year, to just a couple months later to see where we're at. Everything is essentially frozen and at a standstill. But as Councilman Miranda said, it's going to take a while for people to get back on their feet. Restaurants, small business owners, people that live paycheck to paycheck, people that have been laid off, and people that are in fear of getting laid off. I talk to people every day by phone and whatnot, and folks have lost their jobs, and other people are just waiting. You know, maybe another week, maybe another 2 weeks. We don't know what's going to happen. People are scared, but, you know, as a community, we're in this together. We lift each other up. A rising tide lifts all boats, as the saying goes. That's been used time and time and again. We'll get through this, but this is something that, you know, we will remember for the rest of our lives. This is our moment of, you know, uncertainty, but at the same time, we're resilient as people. We always come together and we're strong. And just the United States in general, beyond the city of Tampa, we are a people that always fights and always moves forward in the face of whatever danger or whatever uncertainty we have. You know, as a millennial, I remember graduating college, and it was right as the Great Recession was beginning. It was at the end of 2007, and it was very tough. So my generation is seeing this, 2 times before the age of 40, where, there are no jobs. It is a struggle. It's not as easy as it was before. We see the economy as it is, from the stock market all the way down to the local level. Everybody's feeling this, no matter what class, what amount of wealth, from the very poor to the very wealthy. This is affecting everyone, because essentially everything is at a standstill. But here at the local level, I know everyone is doing their best. Council members, CRA board members, all one and the same, but all the department heads, all the police and fire, all the nurses, all the doctors, people that are, these are the soldiers. These are the people at the front lines that are putting themselves at risk and making sure that we're safe. So I thank all of you, and I appreciate, again, these reports and these discussions, because I know you all are working very, very, very hard. And I just want to say thank you. And that's it. Thanks.
Thank you, Mr. Maniscalco. At this time, we'll hear from Mr. Goods.
Thank you, Chair, for being recognized. I'd like to say good morning to everyone. Chief of Staff, I want to definitely recognize you for being out there on the front lines, being able to get me information when I call from constituents in my communities, and also to all the other department heads who are working very hard. I definitely want to give a shout out to the Recreation Department for making those masks for our healthcare providers, and also the city workers. I've been around a couple of people's houses where they're making those masks, and they're working very hard. So I just want to give a shout out to them as needed. A couple of questions as it relates to the African American community and Latino community. I did briefly speak with Chief Bennett about it yesterday. I had several calls and concerns as it relates to testing. We have several healthcare centers within these minority communities. A lot of the citizens in these low underrated communities do not have healthcare insurance. I know some of the policy has been that you need to have a healthcare provider, doctors, to sign for you to get tested. That's not working in some of these low socioeconomic communities. And I just want to find out, what are we going to do? What is the plan to get with the EPG to make sure we can get this done? Because I believe we're going to have a major problem coming up short if we don't start trying to test in some of these communities, especially in some of these lower economic zip codes, 33610, 33604. We need to be looking at that now. So I'm just wondering, what if any other plans have come up about right now, Chief Bennett, or are we going to have any conversation with EPG as it relates to this situation?
John Bennett, Chief of Staff. Thank you, Board Member Goods, for that question. It's very timely and very critical, as you mentioned. I can tell you that the mayor and staff have been tracking the trends of all of our demographics and as it relates to testing, and everything starts with data. We have been working with the hospitals and the emergency medical side of the equation to try and give us additional data points so we can have a better decision support system well ahead of the testing outcomes. As you know, quite often it could take 5 to 14 days between somebody who has a symptom or somebody who doesn't have a symptom to get tested and get that result back as positive or negative. And by that point, there's a lot of opportunity to infect family members, friends, loved ones, or anybody else you're in contact with. So we have started collecting data at all the possible data points that we can get, and our technology and information, GIS group, are mapping that data to make sure that we can see the reservation, not so much the testing outcome, but how people are registering and making a reservation for those testing sites, and making sure that it looks equitable across the entire city. And anytime that we see a gap, then we bring that through the mayor to the emergency policy group to try and talk about opportunities. And as, again, you pointed out, the family health centers and other federally qualified health centers who have the ability to test, we need to look to see how we can get our transportation disadvantaged community to those locations, as well as asking the Department of Health about the opportunity for mobilized testing, where they can go to an individual as opposed to relying solely on a drive-through or brick and mortar site. And so those efforts continue because we know that certain communities and demographics have underlying conditions well beyond just the travel concerns from the earlier triaging that we heard when COVID-19 hit the United States. And I think it would be good for this comment to be augmented by Osea Wynn, who's been working closely with the neighborhoods and trying to make sure there is equity in testing, awareness, and opportunity. So Osea, do you want to augment this?
Absolutely. So one of the things that we've been doing is we've reached out to the Tampa Family Health Centers to see what are those things that we can do to get testing, as was already mentioned, into those neighborhoods. As Chief Bennett has already mentioned as well, in terms of a mobile test site, we are, through our purchasing department, actually reaching out to those in the community who can provide those type of services, so that we could have more of a dynamic approach for those who, the people in the community who cannot get to the site. There are a number of things that we have to overcome within the Black and Brown communities. One of them is, as we know, is the awareness, as well as those risk factors that are actually impacting those in the community. We've heard of diabetes, we know of hypertension, pulmonary issues, asthma, lung disease. Oftentimes in the community, as we may or may not know, it's the mindset has been that's for someone else. It doesn't impact us until it starts impacting us. So overcoming the mindset that, yeah, we're all in a part of this together and it can impact us, and knowing that there are times when we may have 3 or 4 generations in one household is even more problematic. So again, with reaching out to community leaders and partnerships and making those contacts with like the Tampa Health Centers, we are going to do everything that we could possibly do to make sure that we're really engaged in those areas, impoverished areas in the community.
I do appreciate the chief and your comments, but I want to say this as a person who had asthma very, very badly. Most African Americans have asthma or bronchial problems. And as I look across the nation, I look at the other communities abroad, there's a problem. So I want to make sure that we get this message to the EPG, that they understand that we need to have a drive-through. We need to have a location point somewhere that people can go to who don't have health care, and do what we need to do to make sure we don't have a serious problem on the horizon. So that's my request to the chief of staff, to make sure that the mayor understands that we need to make sure and stress this to the EPG, that we've got to have some testing going on. We can't depend on trying to get over to the stadium. A lot of people don't have cars, it's inconvenient, but if it's somewhere close, we need to try to make that available. So that's my request today in reference to the COVID-19 for the African community and Latino community. If I can go to my next question real quick, in reference to, I don't know if the other council members have gone out to the homeless tent city that we have. I did go out there. I think it's a great thing that the mayor and the chief came up with to combat some of our homeless situations. I had several phone calls and emails about the homeless, and I went out there and saw something that was amazing. I know that the county does fund the Catholic Charities, and I know the city gave some funds for that. So I'd like to know, where do we get those funds for, or are we going to continue to give funds for that project, or ask the county for some help with that?
John Bennett, Chief of Staff. Well, first, thank you, Councilman Gooch, for recognizing the efforts that went into the emergency shelter for our homeless as it related to Safer at Home, and coming up with this emergency home, if you will, that provides food, clothing, shelter, and medical opportunities. The real shout out here goes to Vanessa McCleary of our housing group, who within 7 days, working with Catholic Charities and her staff, brought to the administration an opportunity to support this through an emergency services grant or emergency solutions grant. And that funding was directed to set up this emergency shelter with a continuum of care attached to it that has been long proven for rapid rehousing. So they continue to work with the Catholic Charities staff and the Tampa Hillsborough Homeless Initiative, of course, jointly funded in concert with the entire county to make sure that we're doing the best that we possibly can for our homeless, and trying to use a proven model that has existed in Pinellas for well over a decade, where a vast majority of folks that enter this continuum of care end up in some rapid and sustainable housing model. So the funding did come from a grant. It's being sustained by a grant, and we're hoping that we can use some of that grant to continue this opportunity and build upon this program well beyond the COVID-19 emergency. I hope that answers your question. If not, we're happy to send a memo to all of the board or council on the topic.
Thank you, Chief. That answers my question. Great job, Vanessa LeClaire. I know she's worked hard on that project and for the administration working for our homeless community. Thank you. I yield back, Mr. Chair.
Thank you very much, Mr. Goos. Now, Mr. Dingfelder.
Good morning, all, and thanks to everybody for your hard work. I've got 3 questions or comments. The first one, fairly simple, to Ms. Post. I'm just curious of, in regard to rezoning applications and other similar type of applications that have come in over the last couple of weeks. I would assume that the numbers would be down, but I'm just curious of you know, I mean, how much are they down?
Hi, this is Carol Post. Great question. We thought they would be down. We thought we would be experiencing declines as well, but in fact, we are not. The filings have remained fairly consistent, particularly rezonings are holding pace. So I actually think that's a positive thing, that this industry as an essential industry is continuing and keeping a pace. As you know, we are challenged on the horizon to ensure that we keep pace with these. And I know the council's office is working steadfastly to work through how to address our quasi-judicial hearings and the like, so that we can catch up and then get back on pace. But we are not seeing a downturn in the filing requests. Not yet, anyway.
Okay, thank you, Ms. Post. That's good. That sounds like our community remains optimistic on the economics. Hand in hand with that, Ms. Grimes, thank you for your lengthy memo in regard to City Council's quasi-judicial process. Are we also working on getting the variance board and the ARB, ARC, et cetera, the other quasi boards up and running perhaps in June or July?
Gina Grimes. Yes, Mr. Dingfelder, we're working on that same issue. Kate Wells from our office has already put together a proposed schedule she sent yesterday to the Development Services staff. And she too has a proposed schedule that if followed will allow all those canceled hearings to be caught up by the end of June. So we're hoping June is the month that we can all get back to work physically. And so we have established schedules that if everybody's willing to, to put forth a little bit more effort, and that we could get caught up. And remember too, this requires a lot of effort on the part of all of our voluntary board members for the ARC, the BLC, the HPC. So there's a lot of people, a lot of coordination that occurs with all this, but the staff is supportive of having these extra hearings, putting extra cases on each of the agendas, and as I think they've gotten feedback from the various board members that they're willing to do what it takes to get everybody caught back up by the end of June.
Okay, thank you, Ms. Grimes. I speak on behalf of council. We're all looking forward to getting back and as Chairman Citro said, getting back to work physically. We're all working from home, but also I'm sure that our community boards members will likewise be jumping in to help and to get back to schedule. My last question, probably a little more controversial. I totally, and I'm sure everybody on the phone disagrees with the governor's revised memorandum or order where he included church attendance as an essential service, but that's neither here nor there. He is the governor, and he has that power to do that. On a local level, I would assume that the mayor has the ability, and I would hope that she's still articulating and urging people not to go to church, synagogue, mosque, or what have you. I'm curious, along those lines, Ms. Nguyen and also Ms. Bauman, what is our message to the community in regard to, obviously, we're in the middle of Passover. Last night, on a personal level, in my family, we had a Passover via Zoom, which was a lot of fun and very effective and very safe for our family. And I would encourage everybody in the community to try and hold their religious services long distance and keep that social distancing going. But in regard to a question, Ms. Nguyen and Ms. Bauman, what is our message and how are we getting that message out to the community that even though the governor may allow the church activities, that as a local community, we discourage it?
Okay, this is Osea
Councilman
Nguyen.
I'm sorry. Go ahead, Osea.
No, so I'll talk about what message we're sending, and I'll let Ashley talk about how we're getting it out. So we've reached out via email to our faith-based leaders within the city of Tampa, as encouraging them to practice social distancing by following the CDC guidelines, by saying if they had to gather less than 10 while remaining 6 feet apart. But what we really want them to do is to embrace the use of digital technology for their worship services. So we get calls, we get email messages, text messages, but Ashley and her team have been really instrumental in getting this out to the public. And I'll let Ashley talk about that and what they're doing.
Thank you, Osea, and Councilman Dingfelder, as well as all CRA board members. As of midday yesterday, if you go to tampagov.net/COVID-19, there is now a button for faith-based organizations and our messaging. Yesterday afternoon, ahead of sundown, the mayor put out a Passover message. We fully intend to do that as we move into the Easter weekend. We are also putting a multi-denominational faith leaders message out today. We are finalizing it right now. This will go out both on our social media platforms, but also in an earned media capacity. That being said, in my report, I also talked about the different PSAs and the different platforms that we are messaging on. All of this includes the drumbeat of a social distance message. We also have PSAs running on Spirit Radio, and those mimic that message.
Well, that
and
sounds
one
great.
final thing that we're doing in the direct messaging via email to the faith-based leaders, we did include in that message that if they needed any technical support for streaming, for online services, that we could provide that. We're not providing the hardware, the software, but we will provide the direction that they need and the steps they need to take in order to have a digital service.
And Osea and Councilman Dingfelder, just to follow up on that, this morning, Mayor Castor did a Zoom meeting with faith-based leaders across the city with Senator Janet Cruz and reiterated that message. They are looking to possibly do services via car, but while socially distancing in groups of fewer than 10. So.
Well, that sounds great. Thank you to both of you for that. I mean, I hope that the entire community. I was thinking of a jingo. We all like jingos. I was thinking about stay at home and pray at home. I hope that works. you can you can use that with my permission. All right. Anyway, on a serious note, I appreciate all everybody's doing. Thank you. Bye bye.
Thank you, Mr. Dinkfelder. Mr. Carlson.
Morning, everyone. My colleagues have said a lot of the things that I wanted to say, so I'll say two quick comments and then I have a quick question. First, just to echo, thank you to Chief Bennett and all the staff who are working diligently through this and are responding to us and answering our questions offline, and working to get the job done for our citizens. And especially thank you to the first responders who are putting their lives on the line every day for us. One of my big concerns, other than the health and safety of the public, is of course the fiscal situation, and Mr. O'Hara spoke about it a little bit. You know, I've spoken many times about my concerns about the fiscal recklessness over the last 8 years. Pamela Oreo saved, I won't get the numbers exactly right, but saved somewhere around $150 million in the general fund reserve during the Great Recession. And then the Great Recession was over for 2 years by the time the next administration took over, and the next administration left us with about half that amount. And in addition, we know that the other bond ratings are high, but that's on the heels of 4 tax increases. And during that time, there were a lot of frivolous expenditures, like a plus or minus $12 million boathouse when East Tampa's main community center had rats running in it, and kids couldn't play there. So my concern regarding the fiscal situation, we can talk about it more, and I hope to have Mr. O'Hara in a longer conversation in a month or two. But my concern is because so many taxes have been increased, we probably can't raise taxes. It sounded like the federal government will reimburse us some. I know this administration has been fiscally conservative. One of the things I asked for early on during the budget process was, please, let's add back into the general fund reserve, and the mayor and all of you did that. Unfortunately, it put a small dent in a big problem. And so if we suddenly run short, we have very few reserves in the general fund reserve. The rest of them are all tied to bond ratings, so we can't raid those. And so we don't have to talk about it now, but I just have some concerns, because the last thing we want to do is to cut basic services as we come out of this, because money was spent and accounts were drained down over the last 8 years. So to my quick question, and maybe you all answered this a little bit before to Mr. Vieira, but the business community really would like some predictability. I was on the phone with a bunch of business leaders yesterday. They would like some predictability about when they can get back to work. And I know this is a national and international issue, and there are externalities of people traveling and moving around. But it seems to me if the peak, it was May 3rd, I think now it's the end of April. If the peak is around that time, it seems that we would still be under quarantine or stay safer at home for at least another month after that, right? And so it seems like the earliest we could potentially get back would be June. Do you all have any, without holding you to a date, doesn't it seem, I think we're talking about holding quasi-judicial meetings in June, doesn't that also mean that the public probably could not get back to normal business until at least June?
John Bennett, Chief of Staff. Thank you, Councilman Carlson, for that question. It's on the minds of everybody, both in the public space, our government space, and our partner space. As Chief LaCicero, and I won't speak for him if he wants to augment, but what we're seeing is data and hope. You could see from Ms. Grimes' work with her staff that they feverishly put together a plan to bring back government to its full capacity starting in June, knowing that if those dates had to roll for some reason, that we were prepared to roll the calendar and get caught up. I don't know that there's good science around this yet, other than the fact that the peak has been announced in the state of Florida. I think as a urbanized county the size that Tampa, Hillsborough, and our MSA is, I think we're doing extremely well through all of the leadership that's been discussed and all the hard work of the front line and the messaging and our medical community of flattening the curve below the real risk factor, which relates to our hospitalization capacity. I am broadening the answer because I think it's so important that we stay on focus with the strategy to do that very thing, is to get people back to work and get our economy moving together. As far as timing goes, we're hopeful that if we get past and we keep that curve flat by the designated state peak of, little after mid-April, that things will get back online. But using that relaxation of the state of local emergency, to me, is going to be the flag that starts that countdown to get back to normalcy, because, as we know, there's that 14-day quarantine period if you've been exposed to a known source patient or known risk factor. So I've been using kind of a modeling concept of when the state of local emergency is lifted and all of the things with that there would still be a 14-day window of declining risk, if you will, to get back to normal. So I would say, arguably, if we look at peak and we continue to do all the good things that the leadership at the state and local level are telling us to do, that we can get back online as quick as possible. And I'm going to live off of Ms. Grimes' memo that hope will be full speed, full swing by June or sooner. So that's the best guidance that we have right now, and I hope that reasonably answers your question. Chief LoCicero, any augmentation to that?
Could I just ask a quick add-on to that real fast? Charlie Lockwood from USF, either in the Mayor's Talk Show or another interview, said that he thought that people who had the antibody, meaning people who already had been exposed to it or gone through COVID, could maybe go back to work first. Is that any part of your policy? And is there testing coming for that? Do you know?
That's an excellent question. So we had worked with the county. Our procurement team did some research, worked with the county's emergency management group and emergency procurement group, and researched the antibody testing. And we had a face-to-face with Dr. Lockwood, of course, in a social distancing setup, to validate the concept of the fact that it's difficult to get the traditional testing going. So our thought exactly was that, again, through the mayor's leadership and working with our partners, to accelerate our critical and essential service folks to see about the antibody testing. So the county has ordered over 44,000 kits that hopefully will go towards the first responder groups and those critical and high risk areas. And then in addition to that, we're as a region, because I'd worked with Pinellas County all of last week into the weekend, that we're ordering additional kits, and we are going to try and focus on getting access to get people back to work, because the concept is with this rapid test kit for the antibodies is the 4 different outcomes, which is you're either negative, which means that you haven't been exposed yet and you're still at risk. And then there's 3 levels of positive. And we walked through this with Dr. Lockwood, so I appreciate you bringing it up because he's been a great partner to the city throughout this. But yes, there is a concept that if you show that you have the antibodies, that you would be more resilient to be back in the workforce, and also possibly donate plasma to the community to help others who have COVID-19 recover quicker. So again, Chief LoCicero, any other comments to that?
I think you did it in a couple of parts has been summarized well. The only thing that I would add is that we are looking at all the data and all the scientific reports that are coming out, and just know that the mayor and this administration, as soon as we can stand this up, know that we absolutely will. We just want to make the best absolute decision when the time warrants. Thank you.
Great. Thank you all so much.
Yep, thank you. And one more point on that before it goes back to the chairman is that some of the challenges of getting that stock here is waiting on FDA approval. And there was some guidance issued in the middle of March about the FDA approval, and the kits that were ordered by the city had just received the FDA approval, which are the same ones that Pinellas County just ordered. So just a footnote to that. Back to you, Chairman.
Thank you very much, Mr. Carlson. I just have one question going back to Mr. Good's point. The emergency shelter on the north side of town is working out very, very, very well. My question is, have the people that have been staying there, have they been tested for this? And then secondly, to go a little further, we have a population of homeless here in the city of Tampa. How are they going to be able to be tested? And are we going to be able to get help from either the county or the state to provide testing for those people?
Thank you, Chairman. Great question. One of the things that was designed in the setup of the emergency shelter was the fact that Catholic Charities has a tremendous and longstanding partnership with Baycare. And Baycare is there providing the triage, the testing that's needed, and of course, if so, any treatment. They also have areas on campus that offer the quarantine necessary should somebody have an exposure or have been triaged and tested, awaiting for those results. I hope that answers your question.
Yes, thank you very, very much, Chief. Chief, I would like to thank you, all of your staff, all the administration, for helping organizing this and giving us your COVID update. I look forward to hearing more in the future from you and the staff. So I thank all of you who are on the call today, giving us the information. Thank you very much, Chief.
Thank you, Chairman. At this point, I am going to release the staff members other than the ones that are remaining for the second agenda item, which will Horace Massey, Carol Post, and Michelle Van Loan. So I want to thank all of our staff members and their teams for supporting the message this morning to the CRA board and the public. So, Chairman.
Thank you very much, Chief. Everyone, please stay safe. I will now ask the CRA secretary to play any voicemail messages received regarding the special called meeting and advise us if any emails or documents have been received in connection with this special called meeting and whether those documents or emails have been distributed to all CRA members.
Okay, yes, Mr. Chairman, at this point we have none. Just give me one moment.
Good morning, Chair Citro. This is Celine Lucas, Deputy City Clerk. We have not received any public comments via email nor voicemail messages to be played this morning.
I thank you. And these emails or voicemail messages were to be received as of yesterday, April 8th at 9 a.m.?
That is correct.
Okay, I thank you, Ms. Suling, very, very much. Now
You're
the
welcome.
second item, thank you. Now the second item on our agenda is discussion of a possible loan or grant program for small businesses in the community redevelopment areas impacted by the COVID-19 emergency. No formal action will be taken on this matter today by the CRA board, but after the presentation of this proposed program, each board member will be given an opportunity to ask questions and to make statements regarding this item. I would now like to introduce Ms. Carol Post in the city's administration for development and economic opportunity to discuss the proposed program generally, followed by Ms. Michelle Van Loan, the city's CRA director, to discuss this program as it relates to the city's CRAs. Ms. Post.
Good morning, everyone. Nice to speak with you all again. The essentials that we have here, and I can add a bit more detail after Michelle and Morris provide their presentations, but like many jurisdictions around the country, the city of Tampa is very interested to provide support for its community, the individuals and the businesses in the community that are suffering from the results of COVID and the shutdown and stay at home. The implications of this are far spread, as you have already been discussing, and we feel that it is part of the mission of government to be a backstop, to be a support, and to be able to provide support and assistance, particularly to its neediest constituents when they encounter challenges such as we're facing. So we'd like to discuss with the CRA board how they could participate in this effort. But let me first turn over to begin with to Michelle, who can provide kind of a macro view of what we are looking for in terms of the discussion with this group. Thank you.
Thank you, Ms. Post. Ms. Michelle.
Good morning, Chair Citro, our CRA board members, and our CRA community and public listening in. Michelle Van Loan, Community Redevelopment Department. As we referenced last week at some of the COVID meetings and in response to some of our CRA board comments, a few weeks ago, our CRA staff and myself started receiving inquiries regarding how the CRAs can assist our businesses in distress. And so our CRA team had started looking and evaluating what our options are to assist our businesses during this crisis. Our CRA staff then had been working with our CRA attorney, Morris Massey, so that we could understand our options under State Statute 163. We've been looking at what the other communities around the state have been doing and talking to the FRA legal team to make sure that we all understood to what degree we would be able to assist our businesses. At that time, our CRA staff started to develop a framework for a potential grant program to bring to the CRA board once we started having CRA board meetings again. One of our challenges was, how do we aid our businesses at most risk? How do we identify those businesses? How do we handle comprehensive outreach to make sure we are meeting and reaching all those businesses? And most importantly, how do we make it equitable so that, again, we are reaching out to our businesses that are at most risk of not surviving this crisis? We also needed reasonable criteria. As has been publicly said many times throughout the past several months at CRA board, making the criteria and the eligibility requirements something straightforward that do not act as barriers to our businesses applying has to be a criteria of our program. So some of the goals that we included as we tried to develop a framework and to come up with solutions were how to maintain the integrity of the CRA funds and balances. How do we reduce the potential for businesses shuttering their doors permanently and then resulting in an increase in our vacant storefronts, and again, creating a back 2 steps in the efforts and improvements we've made for our CRA communities. And then lastly, how do we establish a program that's even manageable by our CRA staff of 8 and serve our potentially large number of businesses that are in all of our 8 CRA communities? Last week, while our CRA staff was on this track, we were brought into the discussion with the city track that Carol Post and Osea Wynn, along with the mayor's staff, have been working on. And as we started talking together about the city's efforts and the CRA efforts, we realized that we were mostly in alignment, that we were facing some of the same challenges that I just outlined, and our staff greatly appreciated the potential for trying to piggyback off of the city program that, again, would move the implementation from 8 CRA staff members to the entire city employee base and also their nonprofit partnerships. We also are in alignment to try and address the CRA business weeds without unduly burdensome paperwork requirements, as I mentioned, and also how do we ensure that our businesses within our CRAs are eligible for the program and can apply. So that's basically the approach, what we're trying to do, why we are now in discussions with the city's efforts. And to the last point that I had made about the integrity of the CRA funds. Our CRA policy for more than 10 years has been to ignore our interest money that develops in our funds. The interest collects as a result usually of our capital improvement dollars that have to be set aside as soon as we enter a contract. But when these projects may be several years, while the money is still being spent down, it is collecting interest. One example in East Tampa is when we built the 22nd Street improvements and the roundabout, that was a three-phase program, but all the money had to be what we call encumbered right at the beginning of that program. And so $5 million worth of funding sat in funds over 4 years and developed interest. That interest, again, we have tried to, as a policy, ignore that interest has sat there because we considered that money our rainy day fund for our most dire situations, only to be used as a last resort. And I do believe we have now come to a point that we have reached a dire situation that may call for using this interest. As I've been discussing this issue with our staff and the CRA managers, I have been likening this crisis to if we had a hurricane. If we could visibly see damage to all of our businesses that would physically prevent them from doing their business and conducting business and paying their employees, then all of us would be instantly scrambling to do whatever we could to help our businesses. Well, the physical structures have not been physically wiped out or damaged. The result of what the coronavirus and safer at home and our business interactions and that lack of social interactions to be able to conduct business has had basically the same effect. Our businesses are not physically able to conduct their business anymore, even if the physical structures are intact. So what we have been looking at and what I would be proposing is that if the CRA board at a future meeting did decide to participate in some sort of business grants within our CRA boundaries, that we would use only the CRA interest that's sitting in the account to help fund that. By using the interest, we can ensure that no projects or initiatives that are either already in play, are being discussed or worked on at the community level in our CRAs and subcommittees, none of those initiatives would be adversely affected. All current projects could move forward as planned. And at our March 12th CRA board meeting, I gave you the balances of our current rollovers and all of our funds that we talked about could be used for affordable housing and other initiatives. None of that money would be touched and again would continue to be available if we only use the interest towards any potential business assistance. We do have, as noted in the quarterly reports and has been brought up by CRA board in the past, we do have enough interest, I believe, could help our businesses and make a dent and would work well in conjunction with what the city would do as opposed to trying to have two standalone programs. So with that, I just wanted to give you an idea of what the CRA staff have been working on, what our goals were, what we're trying to achieve to create some sort of context for when Carol talks about the city side. So with that, I would like to turn it over to Morris if he has any comments, and then to Carol to talk about what the mayor's staff, Ms. Post and Ms. Nguyen and all of their staff have been working on to help address the larger community and where our opportunities to align ourselves together between the two programs are. Thank you.
Thank you, Michelle. Mr. Massey.
Morris Massey, CRA Council. Thank you, Michelle, for that explanation. I did want to give the CRA board a brief overview of how we think this fits legally into the framework of the CRA. Typically, as you know, business grant programs are something that the CRA typically does not do. But in this case, we do think that it is consistent with Chapter 163. And let me walk through kind of the general legal limitations on the use of CRA funds. Typically, the four limitations are really the use must be consistent with the state CRA statute. It must be consistent with the approved CRA plan. It must be consistent with the approved CRA budget. And finally, it must be used within the CR area, community redevelopment area that generated those funds. The state CRA statute allows the use of CRA funds on the undertaking of community redevelopment and related activities and services within the community redevelopment area or areas. Community redevelopment includes activities or projects to eliminate or prevent slum and blight. The statute defines slum areas as areas that have conditions conducive to disease, poverty, or crime. It also defines blighted areas as areas with unsafe conditions and or falling lease rates or higher vacancy rates. And while the CRA statute focuses primarily on the construction of affordable housing, acquisition, disposition of real estate, and physical infrastructure improvements in order to remedy slum and blight conditions, it also recognizes special programs and services can also be utilized to address slum and blight conditions like community policing within the CRA. In this case, COVID-19 is a disease-related event, and it's leading to at least the temporary closure of many small businesses because of the safer at home orders to address the event. This could lead to the failure of many of these small businesses, which will lead to increased vacancies and would lead to increased slum and blight conditions. Therefore, I think in this instance, the use of a business grant program as outlined by Michelle Van Loan is legally appropriate under the statute. At this time, and I can turn this back over to Ms. Post to give you a little more detail on the city plans. But at this point in time, we're still working through those plans, and so this is not a time where we're asking for the CRA board to act, and we're still working on, the details of how the city plan will work and the CRA plan and how they'll interrelate. We would like to come back and perhaps have a special call CRA meeting later this month when all those details have been worked out for you all to formally consider this. Also, while we are providing a vehicle for public comment through emails or through the web or through voicemails, by the time you meet next, we should have a webinar type of setup so that people can actually call in and make public comment, which we think is important before you all make a formal decision. So with that, that concludes my presentation. I don't think Ms. Post has anything to add, but if you do, feel free.
I would just reiterate what I think you've heard. It is our desire, as I know it is yours as a board and as individual members of the community, to create a program that can support those that are in most need. And that is what our program, what we are desiring to do, and we are working through the details of what that plan would look like. But what I can tell you at the highest levels is that it is something that would focus on providing assistance to the neediest of the community, those that are most vulnerable and are more likely to fall through the cracks, and that we are looking to target the most basic needs for businesses, like you're seeing in other communities and jurisdictions, things like rent, mortgage, and utilities, and that it would be for a short defined period, because what we're trying to do is create a targeted bridge that helps these businesses get through the immediate challenge before some of those state and federal funds that are on the horizon start hitting their mailboxes. So we're really just trying to plug a gap with a very short-term targeted program of assistance. And I'll turn over to questions.
Chairman Citro, I think we're turning it back to you. This concludes the presentation.
Yes, thank you. I'm sorry. The phone went on the fritz for a second. Very, very, very well done. Thank you very much. I will now call on each CRA board member in alphabetical order for his comments or question regarding this proposed program. Again, let's try and keep your questions or comments limited to about 5 minutes, and let's keep them limited to this discussion we had just had. Let's start with Councilman Carlson.
Good morning, everybody, and thank you. I think we all got briefings individually, and I spoke at length with Ms. Post, and I know she has a big vision for economic development, and I think she'll come back with a great plan. And I think it's probably one that that we will probably. I want to hear the details about it again next week or whenever we come back. But I think it will be one that we would want to support and one that's needed, especially in this bridge time. My concern, I have a couple concerns, but one is about the legal interpretation. And you all may remember 6 or 8 months ago, I suggested the idea of, instead of facade grants, spending money on something like this. And the legal opinion we got at the time was that we couldn't do it. And St. Pete's legal interpretation has been a little bit more liberal than ours on the ability to offer services and help businesses. I spoke at length with Ms. Zellman and Ms. Morris about this, and so we don't have to cover it again here. But I just have some concerns. If it now meets the legal definition, then it should have back then. And so if we think it does, then I think we ought to readdress that issue in a few months to see if we can look at helping businesses. And if it doesn't, then there could be some kind of legal challenge to it. So I think we need to, as a city, we need to figure out what the backup plan would be if it is legally challenged. And then the other thing, which I mentioned to Ms. Van Loan, we've talked about doing strategic planning for our CRAs. And I think that this also brings up another issue, that we need to figure out what our specific goals are. And I think our goals need to tie up to whatever Ms. Post comes up with for the city overall. You all know I presented the Tampa scorecard, which shows that Tampa didn't do very well economically compared to our peers over the last 10 years. Even though it was a boom time, we did okay. We didn't do as well as our peers said, or our the cities that we want to compare ourselves to. And so there's some underlying economic issues that we have to address. And this, for example, I don't think is an idea that came from the CACs. The CACs are supposed to be advisory. I think they're going to get feedback from the CACs, but somehow we as a board need to come up with what our guidelines are, what our guardrails are, what our areas that we think in which the money should be spent that would be most effective. And I think taking Ms. Van Loan and Ms. Post's advice on how does it build up to a larger goal. Like I'm on the board of an education foundation, and one of the things that we sponsor is scholarships for at-risk kids. But the interim goal is how many scholarships do we get? But the ultimate goal is what's our graduation rate, and are we able to keep kids in school? And I think whatever we do needs to build up to some kind of economic measures, and we can work with MOAS and USF on those kind of measures, and I hope predictive analytics. But if helping businesses is a part of it and it's legal, then we need to look at that. But we should look at the other kinds of services that a CRA can and should do, and not necessarily looking at what other cities in Florida are doing, because they might not be doing it well. Some have even been investigated for what they've been doing. Instead, we should look at what is legal, what is a creative idea. We've got an excellent team at the city now in economic development and CRA, and I think we can come up with some great ideas to try to drive the economy forward, not just to fix this temporary problem, but we've got a systemic problem, poverty, homelessness, 50,000 unit housing shortage even before we hit this time. And so we need to address all that. Finally, if there is a rainy day fund using interest money, I think we ought to make that explicit in the budget, and we ought to talk about it, and we ought to, as a board, agree to defer it every year as a rainy day fund. I'm not aware or don't remember that we did that before. Anyway, those are my comments. Thank you all.
Thank you, Mr. Carlson. Let's go to Mr. Dinkfelder.
Thank you, Mr. Chairman. And Michelle and Ms. Post, thank you for your presentations. Michelle, I know you've given this to us in the past. I don't have it handy. Just curious, a couple of questions, but just to start with, just curious how much interest we have in the various funds, specifically the larger, more active CRAs, downtown, East Tampa, West Tampa, et cetera. Could you give me that? And then I have a couple other questions, Mr. Chairman. Thank you.
Good morning, Michelle Van Loan again. To give you some of the larger numbers, East Tampa has just over $1 million. Downtown has just over $1 million. Channel District has a little over 700,000. Drew Park has a little over 500,000. West Tampa just passed 100,000. Ybor 1 is about 130,000, and they get smaller from there.
Okay. Yeah, that's not insignificant. I didn't recall they were that large, and I'm glad to hear that they are. So we have some real money to work with. I know you're going to make a more detailed presentation down the road, but is there a dollar amount that you're thinking about per business or per small business? To be able to make the money spread around, but have some impact per small business, like $10,000 or $20,000?
Carol, did you want to take that answer?
Kind of how much?
We don't have the details for that yet, and I think in the best case scenario, we want to provide as much benefit as we can, but given a limited pot of resources, we also want to spread it across as wide a swath of participants and recipients as possible. So that's kind of the tricky part of the equation, is how can we get as much as possible to as many qualified recipients as possible, and we don't have a final data set on that yet.
Right.
And to give you a sense of volume, just in the CRAs, now these are all total business, this would not be all at-risk businesses, we have over 8,000 business licenses issued within just our CRAs. And even if we eliminate some of the business licenses that are issued for all the extra certain businesses, it's by person, for every attorney, for every accountant, for every PE. So even in reducing it, we would still be looking at a total pool of at least 4,000 to 6,000 businesses, and then defining what is at risk. At some point, how do we help the truly needy who would not make it through this crisis without some assistance? So looking at volume is also something we have to balance. Enough money to make a difference, but not so much money that we can't help enough businesses to make that kind of community impact.
Yeah, I mean, and that's where my head has been at in regard to, $1 million is a lot of money, but if you give out $20,000 per small business, that's 50 small businesses. So, and then you can go from there. So I think it's important that we don't get the community's hopes up too much, because we do have limited ability to help in terms of number of businesses and/or dollar amounts. Somebody was trying to chime in. Was that Carol?
Yes, thank you, Mr. Dinkfelder. Was that Ms. Post, or was that Ms. Van Loan?
Hi, it's Carol Post again. I thank you for those comments. That we feel exactly the same way around the desire to make this as beneficial as possible, but managing the reality and managing expectations around that. And one thing to note is that, and I believe Ms. Van Loan referenced that, the desire to partner with the CRAs is as a supplement to other sources of funds. So we would be looking to that as a backstop, and not for the entirety of the source of pot of money for this purpose.
And then my last comment, Mr. Chairman. Thank you, Mr. Chairman. My last comment, more than a question, is and I'm sure it's obvious, but I just want to state it anyway, is obviously we care for the small businesses, but we also care for their employees. So I'm going to assume that as part of the criteria, that we would, mandate that some part of that money needs to flow through to to their employees, whether or not they're working or not. So I'm not even looking for an answer on that, but I'm just going to assume that that's going to be part of it. That's all I have, Mr. Chairman. Thank you. Thank you, Carol. Thank you, Michelle.
Thank you, Mr. Dinkfelder. Mr. Goods.
Thank you, Mr. Chair, for being recognized. I've been talking speaking to Ms. Van Loan in reference to my position on the small business component here, and I'm adamant that I wouldn't support anything that dealt with a loan. A lot of the mom and pops can't pay back a big time loan, and I look at some of the programs that the federal government have rolled out and read a lot of them, and I don't see a lot of these small mom and pops being able to get any of that money. A lot of those businesses don't have the good financial records, they're not up to date, so they won't qualify at all, and they'll still be in the same financial situation. But I do think the CRA can help. I'm going to send Ms. Van Loan and Ms. Post some ideas that I've written down, but I'm going to share it with the council as it relates right now. I think number one, businesses should make at least should make less than in tier A between $125,000 or less a year, and in tier B $250,000 less. That way you have two different tiers. With those tiers, those businesses you get between maybe $10,000 and $20,000 within the separate tiers, because you may have more employees in tier B because they have a bigger value versus tier A. When you have Mrs. Jones who's making maybe $70,000 maybe a year at her little sandwich shop, she needs that revenue, and a loan, she won't be able to pay that loan back. Also, I look at it will take a long time to create an online portal to apply. We should create a paper application that can be distributed ASAP and funding passed out ASAP. I see all these online services that they just get jammed up, and if people can't get through, they get discouraged, and we don't want that to happen. Also, I look at some of the requirements. The only requirement we should have is that the businesses must have been established prior to January 31st, 2020, which is the date of the disaster. Also, the business must be incorporated, and the funds must be deposited into a business account. If the business does not currently have a separate business account, they must open one prior to applying. Several financial institutions in the city offer free checking accounts. Again, I don't support any type of loan. It's got to be a grant base. I do agree with funds from the CRA should come from the interest the CRAs currently have. This way, we do not disrupt the current budget for any of the CRAs. This should include sole proprietors, self-employed, independent contractors, partnerships, Cs, corporation S's, LLCs, and having employees is not a necessity to get this grant funding. The bottom line, gentlemen, is a lot of these businesses will not come back without some help. A lot of these businesses that have been around for years, that barely make it, are closed and don't have the capital to reopen. So I think a jump start to help some of these small businesses, what I call the little people that Mr. Rand always refers to, the little people, we got to help the little people. Some of the bigger businesses, they'll be able to recover and be able to apply loans because they have the accountants, they have those people that can fill out these forms for the federal government. Most of these mom and pops are elderly people or middle-aged people that don't know how to do these type of application processes, and I'm just geared up to give them the money. So I yield back to the chairman. That's my spiel on it. My thing is no loans but grants.
Thank you, Mr. Goods. Now to Mr. Maniscalco.
Thank you very much, Mr. Chairman. I appreciate this discussion in helping small businesses, because with this 30-day shutdown, I know a lot of businesses that, they don't have a cash-rich savings account. They barely make it to pay the rent, to pay the utilities, to pay the employees if they have employees. Some people are self-employed, some are families, some are spouses, partners, whatever it is. We have to look at doing what we can to help these individuals, because when you have, as we are in this shutdown, when we have 30 days of no activity, not everybody sells on the internet. Not everybody has a restaurant that has curbside service or delivery. People are hurting. People are worried. I've already heard of businesses that are closed now per the order and will not be reopening. Businesses that have been in business for a while, and the term that's used is businesses having to pivot. The word is pivot, because this is now, businesses in a survival mode and not knowing what they're going to do. One thing that does bother me that I've heard is, with the landlords, it's not about, the landlords, they have to collect their rent because, many of them have mortgages to the bank and they have obligations too. But it's, hearing stories of, well, my landlord says, although evictions have been halted, if you don't pay on time or within the grace period, if there is a grace period within the lease, they start tacking on the late fees. And it's not about, I understand the landlords collect the rent to in turn pay the bank or pay the mortgage or whatever they do with that income. But the lack of compassion and understanding that in the stories that I've heard, whereas it's business as usual. Remember, rent is due on the 1st, and if not, late fees start racking up, and seeing the lack of concern and not caring about the situation. People are hurting, people are struggling already to make that rent payment, which many are making that rent payment, but to say, late fees will continue to rack up, should you be late or per day, there's an additional fee. I know this is a little bit off topic, but being that this is recorded and this is public and broadcast, I urge landlords to, and not all of them, because there's a lot of good people, but in some of the stories that I've heard is to show a little bit more compassion considering the situation. This isn't, well, this business is struggling or this tenant is struggling. The whole world is struggling. The entire community is struggling on so many levels. A lot of people with some landlords, it says, amidst COVID-19 and the difficulties, we encourage you to apply for a small business loan from the SBA, from the disaster fund through the state, whatever. But again, as it has been mentioned, not everybody qualifies. Not everybody has the, you have self-employed individuals. It might be a one-person operation, whatever it is. They may not have the employees in the payroll, whatever, but they have the utilities and rents due. Again, we have to do whatever we can in order to help keep these businesses open in whatever capacity legally we can do in whatever way, whether it be a $500 grant, whatever it is. You think about it, a little bit goes to pay the electric bill, a little bit goes to pay licenses and fees or the insurance that they have, or towards their rent, because some people have, they have the rent of their business, they have a mortgage on their home, they have car payments, whatever it is. I come from a family of small business people. I mean, going back many years, and I've seen it. I understand the struggles. They are not big corporations. People sacrifice a lot and do what they can and work so hard to make it on their own as sole proprietors, as business owners. But I'm glad that we're taking up this discussion. I know St. Petersburg has brought this up in speaking to some council members over there. I think it's the right thing to do because, as I've mentioned earlier in my previous comments, we are all in this together. If you look back at the Great Depression under the Roosevelt administration in the 1930s, you have WPA projects. For example, the JCC, Jewish Community Center, Fort Homer Hesterly Armory, that's a WPA project. You see that in bridges and buildings all over the country. The government put people to work in order for them to earn a living and put food on the table and provide for their families and for themselves and whatnot. So if you look at this historically, going back less than 100 years, in a time of crisis, we have to look at all avenues. I understand the federal government has the stimulus checks for those that qualify. It helps a little bit. It's a temporary solution. It might help some people stay afloat, but as a local municipality in the city of Tampa, with the CRAs and how they're broken down by different CRAs throughout the city and the funds that are available, we have to look at what we can do to help, because it's I think it's our duty as public servants, as elected officials. When we campaign, we say, we'll be the voice for the voiceless. We'll stand up for the little people. And that's what we have to do. I mean, we have to look at all options and avenues, look into our hearts, be compassionate. I understand, the world is tough and life is tough, and this is an incredibly difficult situation. And some will say, well, business is business. Some landlords will say, well, you signed a lease. That late fees will happen. That there is an eviction. That you have a grace period. But set that aside. This is not, you think about it, when we're in Florida and when a hurricane strikes, it affects one part of the state. A hurricane hits Miami or a hurricane hits the Panhandle, and they feel it. This is a hurricane that is hitting the entire country, if you want to look at it like that, if that's even appropriate. And everybody is struggling. Therefore, we have to look at all of our options. And I'm glad that we have this discussion and we're having this. And I know that this is a compassionate city council. This is a compassionate CRA board. This is a compassionate administration. These are unprecedented times. We have to do what's right as human beings, and look out for one another and try to lift each other up and weather this storm together. And that's it for my comments. Again, I appreciate everybody that's your words. I know that we're open-minded individuals looking at different ideas to do what is right, but we have to help the people. We have to help the people that are struggling, the most. We have to keep folks afloat. We have to keep the economy going. It's not just good for them, it's good for our city, it's good for this community, where we're all looking out for each other. We have to look at it as we're a big family, and in a family, people care for one another, try to help one another. This situation is temporary, is how I look at it. If we make the right decisions and wise decisions from the federal government all the way down to us, we'll be able to get through this and move past this and become stronger in the end. So thank you very much. That's it.
Thank you, Mr. Maniscalco. Mr. Miranda.
Thank you, Mr. Chairman. I appreciate the opportunity and thank all who have spoken before. It's very logical, very understanding of what's happening. However, Mr. Massey put it into perspective about the statute. 163 talked about what plan do we have, how much budget do we have, and what's the CR area. So I would imagine then that the budget will be within the confine of each of the CRA areas. Am I correct? Not a total. It's each CR area has got a budget. That's what you have to give. Am I right, Michelle?
You are correct, sir.
Okay. All right. Well, then what creates blight? Way before there was a Corona-19 virus, blight. Blight doesn't happen over a day and overnight or a month or a year. It takes time. You don't hardly notice it until 1, then 2, then 3, then 4, then 5. And in the past, whether some of us like it or not, it's been an effective tool that the CRAs have used when you put a certain portion and the property owner puts much more than that portion to fix the facade. Facade changes the eyesight of a person to something that's not too pleasant to look at, to something that becomes much more pleasant to look at, and therefore the area gets a euphoric feeling that we're going to be successful. We're not going to let blight take over us. We're going to take over the blight. And that's why I've always supported that facade grant program, and I always will. And I'm not here to apologize about anything I've done. So let me go about the loans, which is the discussion that we basically talked about here, or the grants, whichever it's going to be. Do we have a plan? No, but we're working on one, I'm sure. The budget was just discussed very quickly by Michelle, and an excellent question by Mr. Dingfelder. And I think that there was 2 or 3 CR areas that had $1 million. Some had 700,000, some had 500,000, some had 100,000, some had very little. So when you look at that, it sounds like a big aggregate number. But when you look at it on what's coming, I don't know how many of the small businesses or any business is going to apply for this. I don't think that just because you're a small business that you're going to be in dire need and the big businesses are not. I'm looking at everybody. And let's take that in perspective. Look at the Outback chain. You think they're happy? No. Look at the Columbia restaurant with 1,400 employees in their chain operation. You think they're happy? Of course not. They're in the same boat as I, as you, as everybody who is maybe has a business, and he is or she is the only one doing that business, that work. He is the employer, he is the employee, and he's got to handle all of it. So those things all have to be taken into consideration to those that are going to draw this plan that we talked about. The budget is set. It's only on the interest that we have collected on that money that Michelle spoke about. And then you look at the CRA area. All of them have, look at, just give you an example what Drew Park looked like 15 years ago. Look at it now. Look at the areas and areas of West Tampa that are coming through. Look at the areas in downtown. Look at the areas significantly improved little by little in East Tampa. Look at the areas that the CRAs are there. However, those CRAs are actually dollars that belong in the general fund. And I always question myself about the preponderance of the people that have no CRA and indirectly are paying taxes for the CRA because the money is not in the general fund for all to use. And I understand that. So what I'm trying to say is, let's get together. Let's make this thing work. I don't know how many individuals are going to apply, whether you're a single operator of one business or many businesses. What the amount that you're going to give out? Is there going to be a cap on the grant program or the loan program, whatever it is, one or the other? Some people, it says possible loan or grant program. It doesn't say which one. So I have a liberal heart, but I have a conservative mind. So I like to see what the plan is. I like to see if it's a loan, how's it going to be paid back? If it's a grant, I understand that part also. So I'm here to say, I'm here to help. But like I said, I have a liberal heart, but I have a conservative mind. And I'm not trying to be different. I'm trying to say I want to help, but all of us are in this boat. And if we don't move the boat out of the dock, it's going to drown because the weight of the preponderance of problems that we have coming are going to outweigh the amount of money that we have, no matter if it's $3 or $4 or $5 million. That sounds like a lot, but it's really a drop in the bucket of what we need to do. Thank you very much, and I'll be working with all my colleagues to try to solve this problem. Thank you.
Thank you very much, Mr. Miranda. And now, Mr. Vieira.
Thank you, Mr. Chair. I wanted to thank all my colleagues for your comments and questions. All have been excellent. Thank you, everybody. You know, there have been a lot of good points made. I wanted to hone in on some of our small businesses. I mean, what we're looking at right now is, excuse me, coughing over here, acute economic trauma care. I think it was FDR that said something to the effect of, try something, if it fails, try something else, but above all, try something. And, you know, the CRA using all tools that we have right now, and as a city for areas outside of the CRA, like Councilman Miranda wisely noted, is certainly something that is worthy. You know, for a lot of our CRA businesses, it's a matter of also finishing what we started. We have a lot of CRA area businesses that have gotten grants, facade grants, et cetera, that are right now at risk of going down. A perfect example is a gentleman I was just in dialogue with, Matthew Juarez of Bay Cannon Beer. I know some of y'all have been there. They opened, I think it was in late summer of last year. Bay Cannon Beer got a facade grant, about $17,000. It is a perfect example of what we have to do in terms of the businesses that we really have to aim for, not just for the moral solidarity with these businesses, but also the CRA finishing what we started. Matt opened up Bay Cannon Beer in the West Tampa area. He was really, really excited to be part of that economic revival in West Tampa, wanted to be a stakeholder there. And as a partner, he found our CRA board with a facade grant. Matt and his wife, Adrian, they poured their heart and their soul into this business with the help of the CRA. And they were doing well until COVID-19 comes and gives them a Category 5 punch to the gut. And other small businesses as well. Now, Matt's working hard. Bay Cannon Beer had to close down their kitchen. It's just Matt and his dad sending out beer orders. They're trying to stay alive. They're drowning right now, and they have a straw, really, that helps them stay alive right now. But I think businesses like that are looking for something more than a straw. When I talk to folks like Matt and others like him, they talk about the different things they need, things that this program could really, really help put a dent in, things like utilities, things like access to capital, something that my friend and colleague, Councilman Goots, talked about, differences between grants and loans. Grants are pivotal as businesses don't necessarily need more debt. But a path to stay afloat and keep folks here in the city of Tampa on board and employed. While there are certain businesses that can take part of loans, we also need part of this program to have a robust grant component. In talking with Matt, he talked about CRA, maybe tying liens to the ones like they did with the facade grants to ensure compliance, so that if we do grants, we can make sure that we have compliance and accountability in that regard. I bring up Matt and Bay Cannon Beer because we poured money as a CRA as an investment into Bay Cannon Beer. We poured almost $18,000 as a CRA. And if Bay Cannon Beer goes down, which I'm using as an example, we'll waste that money. That makes no sense. We made an investment. Let's finish it, because the CRA is also stakeholders. So there's not just a moral argument of being our brother and sister's keeper at CRA. but a financial interest really in terms of finishing what we started. And just lastly, to build on something that my friend and colleague, Councilman Miranda, said, that, when it comes to our role in the city and city council, let's obviously take a look at areas outside of the CRA that may not get the benefit of this. Areas like Sulphur Springs, Bush Boulevard, Fowler, et cetera, areas that are very, very talented and need help, just like areas in West Tampa and Ybor and East Tampa who are subject to CRAs. So we'll obviously, I believe, have a citywide approach. But as it pertains to our role here today as a CRA, when it comes to many of these businesses, we have to finish what we started. And I certainly hope that we do. So this is an endeavor that I look forward certainly to hearing more about, but I'm sure that I'll be very supportive of it. I'm sure. Thank you very much, Mr. Chair.
Thank you very much, Mr. Vieira. As a small business owner myself, I can attest to the economic impact that this crisis has had. My small business is closed down, and all the small businesses in this town are suffering. But that's one of the reasons why these CRAs were created. They were created to help the economy in blighted area. And while I agree with all my colleagues on this, I think that Ms. Post and Ms. Van Loan, I'm getting the consensus that we need to have another meeting. And I am hoping that April 30th will give you enough time so that you can come back for even more recommendations to the CRA board. Is that giving you both enough time?
Yes, it's actually maybe too much. I don't know what the window is, if there's an opportunity to connect with this group before that time. One of the aspects of this is to have a real sense of urgency. We're looking to move swiftly. So with your permission, and if the agenda can accommodate, we would come to you at the next possible opportunity.
Mr. Chairman, John Dingfelder here.
Mr. Dingfelder.
I know there's a movement to get us together on the 16th as a regular city council. Maybe we could have a quick piggyback, as a CRA meeting. Just a suggestion.
Thank you, Mr. Dingfelder. Duly noted. However, there has been some items brought to my attention. Ms. Post, how about the 23rd?
I think that would be great. Thank you. Yeah, the 23rd would be perfect. Appreciate the accommodation.
Ms. Post, that's no problem. May I ask Mr. Vieira? You there?
Yes, sir, I'm here.
Okay, I believe we might be having some sort of meeting with the City Council on the 23rd. Would you mind if we had a CRA meeting immediately following, or giving us a half-hour time in between?
And I believe it was the 16th, if memory serves me right. But nevertheless, yeah, without a doubt. I mean, I would. I mean, you're the chair. I would suggest that it be over the phone, as in person as unnecessary. I would think, so long as there's no votes. But just my thoughts. But yeah, I have no objection.
All right, thank you very much, Louis. Then before I end this meeting, I will go in reverse order and ask each board member if they have any other CRA issues they would like to raise before we close this meeting, and if the 23rd at 9 a.m., unless Mr. Massey has any problems with that, if they were able to have the meeting at that time, be able to be with us for the meeting at that time.
I want to.
Hi, this is Morris Massey, CRA attorney. The 23rd is fine at 9 a.m. I would note, I think the city council calendar has a workshop scheduled for that same time. We could do the CRA first and then flow into the workshop. If we're still doing it, we could do both virtually, I think, at that point in time. If that's the pleasure of the CRA board and obviously the city council. So that would be my suggestion.
Okay, thank you very much, Mr. Massey. So again, we'll go in reverse order for any kind of closing comments or questions, and let me know if 9 a.m. will be fine for each board member. Let's start with Mr. Vieira.
None, sir, and that appears to be good on my calendar.
Any further comments or questions, Mr. Vieira?
No, sir, Mr. Chair. Thank you for today.
Thank you very much. Mr. Miranda.
I'm fine with any day the members choose. I'm fine, and thank you all for cooperating and working very diligently for the public.
Thank you, Mr. Miranda. Mr. Maniscalco.
No, thank you very much. You know, the dates you mentioned, times, everything is fine, and I appreciate all the wonderful comments today.
Thank you very much, Mr. Maniscalco. Mr. Goods.
Thank you, Chairman, for your leadership. As we were
Where
speaking, I listened to
clock come from?
Can you hear me? Sister, can you hear me?
I think someone walked into his office.
Oh, okay. All right. Well, let's continue. What I was saying is, Mr. Maniscalco, you are correct. And I want Ms. Van Loan and Ms. Post to also hear this as well. We talked about the business, but there are a lot of people that are going to be displaced with who've been laid off, which my daughter was one, and I've got to help her with her rent. So we may need to look at getting with housing as well as a part of this plan as well for those who might need some rental assistance as well. That's going to happen. I've set several people I've had to call and talk to their landlords over the past couple of weeks. I've seen bunch of people send notices to my office. A lot of these apartment complexes are sending out 3-day eviction notices already. So we need to also be prepared for that too. So I'm hoping that we're looking at that as it relates to housing as a component, probably with Mr. McClary's office, but we need to look at that as well. So I'm looking forward to a robust policy to come back within a couple of weeks so we can hear on both aspects of small businesses and also housing. That's going to be critical. Thank you.
Thank you, Mr. Goods. Let's go to Mr. Dinkfelder.
Thank you, Mr. Chairman. Great meeting. Appreciate it. I'm free any day that you set this for. I think the sooner the better in regard to getting this small business program up and running as quickly as possible. So if we could have any kind of telephonic meeting on the 16th and then perhaps something more formal on the 23rd or something like that, that'd be great. But I'll let you handle that. Thank you, Mr. Chairman.
Thank you, Mr. Dinkfelder. Mr. Carlson.
Hi, thanks. I would leave it up to the chairs to pick the best date. And then back to the strategic planning thing, I think just about whatever money we gave within a CRE district would accomplish something in the community. What we should do as a board is sit down and figure out what's the highest, best use of the money that we have. We're custodians of the public's money. This money is really the rest of the city subsidizing the CRA areas, and there are at least a couple where they really need it, and we need to evaluate the rest of them. Do we still need the CRAs? Can we put a cap on them? If we had a cap on some of the CRAs, like the downtown ones, we wouldn't have this discussion. Ms. Post could just redirect the money to the places that are needed, and then on a regular basis, we could redirect the money to East Tampa and North Tampa, Suitcase City area that desperately needs money. Just one last thing to the public. You all remember that we faced Hurricane Charlie and at least one other hurricane that threatened to wipe out all of Tampa. And we sat the night before in the morning thinking that Tampa would be completely gone like Katrina hit New Orleans. And despite getting hit in 1 year by 4 hurricanes, we survived. But the one thing we learned is that we all have plywood in our garages. Hopefully you all have plywood in your garages from those times. And so I hope that these pandemics will come again. It might not be soon, or it may be, but we should learn from this. We should continue to be resilient and innovative as we've always been. And I think the future looks bright once we get past this. We just have to learn from it and make sure that we continue to grow the city from the bottom up as we've always done, and do it in an innovative way and in a collaborative and friendly way, as the mayor would say also. Thank you all.
Thank you very much, Mr. Carlson. Again, I would like to ask Ms. Post and Ms. Van Loan, if I were to call an emergency meeting on the 23rd at 9 a.m., would that be suffice and be fine with you?
Michelle Van Loan, yes, sir.
Yes, sir, this is Carol. That would be great. Thank you.
And thank you very, very much both. In the power in me vested, I would like to call for another emergency meeting of the CRA board on April 23rd at 9 a.m. I want to thank everyone for making this teleconferencing meeting very easy. The cooperation by the CRA board members, thanks to the administration, city clerk's office, the legal staff for their help in this meeting. It was very successful, and I could not thank you enough. Thank you to Mayor Castor for your leadership, and to all the first responders that are out there, police, fire, EMS. I'd also like to thank all the doctors and nurses that are on the front line that are helping everyone, not only in the city of Tampa, Hillsborough County, state of Florida, but across the United States. Thank you for being dedicated. Ladies and gentlemen, this is a time for families. And I wish everyone a happy and safe Passover and a happy and safe Easter. If there is nothing furthermore.
And Mr. Chair, if I may, I was going to make a quick comment. This is Louis Vieira.
That's correct. I was going to turn it over to you, but if there's nothing more, I'd like to turn it over to Chairman Vieira.
Thank you, Mr. Chair. I appreciate that. Just very, very briefly, and I think everybody's been briefed on this, but just for the public and everybody listening, briefly, the administration has requested a special call meeting to address two issues. University of Tampa bonds totaling about $150 million in CDBG or Community Developed Block Grant funds, which receive millions of dollars from Housing and Urban Development, HUD. Both are time-sensitive matters that the City Council will need to take up in person on Thursday, April 16th. I am told by City Legal that only in person will suffice for these time-sensitive matters. I want to stress these are not quasi-judicial and do not require live appearances by many people, a quorum, bare-bones staff, and that's it. A memo will be forthcoming on the venue, which is in development. I anticipate that each of these hearings will take a very short amount of time and would request everybody's cooperation in that regard. We are working on using the safest method possible, and when it comes to public comment, it will be incorporated as much as it has been incorporated here today, with an emphasis on virtual feedback. So a formal memo will be forthcoming on these issues. Thank you, Mr. Chair.
You are very, very welcome. Any other board members have anything in closing? Seeing none,
Mr. Chairman, this
we
is
are
John
adjourned.
Bennett.
Hey, Yes, Chief Bennett, please.
Thank you, Chairman, and also to Chair Vieira. I just want to make one comment as council works probably through Mr. Shelby's office to decide the quorum. The venue will be council chambers, which is being professionally sterilized ahead of the 16th event for the physical quorum. But I'm asking council for their own safety and of course the safety of managing the COVID crisis that only 4 members elect to be in person, because the room will be configured for that social distancing, workplace distancing. So despite the desire to be in beyond a quorum, it's going to be set up to accommodate only 4 folks with the proper distancing. So I'll let you decide who those 4 are.
Yes,
Mr. Chairman.
And may I, Mr. Chair?
First, let's go with Councilman Vieira, and then I believe Councilman Miranda will be next.
Thank you.
Just and thank you, sir. Just very briefly, when it comes to the 4 who are there, I would of course wish to be there as the chair. And then when it comes to this, I obviously have no preference on who is there or who is not there, but we should only have 4. And if I need to draw straws, I will. But let's try to work that out with the offices, and otherwise we'll have a lottery system. And that's it. Just my thoughts. Thank you, sir.
Okay, Councilman Miranda.
I was going to say, Mr. Chair, that I would volunteer to be one of the 4. I appreciate it.
And Maniscalco, I'll be there.
Mr.
This
Chair,
is Carlton. I
Vieira?
think we should just do
Hang
draw
on, Mr.
straws because probably all.
I'm sorry, Councilman Carlson.
sorry to talk over you. I think probably all of us would want to go. So I think the best thing to do would just be for Chairman Vieira to draw straws.
Okay.
Thank you very much.
Mr. Chair? Dingfelder.
Councilman Dingfelder.
Thank you. Yeah, I think that's fine. Mr. Chief Bennett, I would suggest, because it's sounding like all 7 council members will be there, it does not need to be televised. It only needs to be, you have to have a clerk there. You don't need to have the television. So I would suggest we find a larger presence, a larger place, whether or not it's out in the courtyard or at the convention center or something like that, just to have a larger space, not only for council, but for staff and for everybody. I think all 7 council members probably want to be there. But regardless, I think we can do it. We don't have to do it in our chambers. Ms. Grimes and I discussed this the other day, that does not need to be televised. And all we need is a clerk and perhaps a tape recorder. So that would be my suggestion. Again, Mr. Chairman Vieira, this will be on you, but I would suggest a larger space, and perhaps if the weather is good, which is hard to predict, an outdoor space.
Okay, may I, Mr. Chair, speak? This is Luis Vieira.
Mr. Dingfelder, are you finished?
Yes, sir. Thank you.
Yes, Mr. Vieira.
Thank you very much. Yes, my statement indicated that we were looking at different venues, and I was having some private discussions with staff yesterday, administration yesterday, indicating, because my idea was actually to have it outside, quite frankly, in the largest venue possible. That could not be done, that it has to be televised. So we may be getting what appears to be conflicting information. So I would suggest that I work with the administration offline. Councilman Dingfelder, I share your sentiments 100%, sir. And if we can have it in another place, trust me, I will. So I share your sentiments, sir, and appreciate your remarks. But we may be getting conflicting information, so I want to follow up on that, like I indicated in my statement.
Is that it, Mr. Chair Vieira?
Yes, sir. For now, yes, sir.
Thank you very much. Chairman, as the legislative branch of our government is essential, I would like to let you know that I will be more than welcome to be there in person also. Again, any further comments from any CRA board member? Seeing none, we are adjourned. Thank you all very much.
Bye.
Thank you.